Today. So welcome to Substance Use Disorder in Youth, our Navigator training focused for this month, brought to you by California Bridge. My name is Sherry Cisneros. I'm the Navigator Program Director, and we are always so happy that you're joining us. We always try to make these trainings useful, and I don't think you'll be disappointed today. California Bridge is a part of the Public Health Institute as well as Department of Healthcare Services. We have no disclosures. We do not take money from anybody. So if we use a trade name or any type of service, it's with no ill will, right? Okay. And all of our materials are available. The slide deck will be available after the presentation, and you will receive it in our post-event email. So we will be sending that out today, as well as the evaluation. So welcome again for the best experience today. The most important thing I want you to do is make sure that when you type a question for the chat, and we strongly encourage questions, please address to everyone. Sometimes it has to only the host and the panel. And, we want to make sure everybody, if you have a question, everybody sees the question and knows what's going on, because that might be the question they were thinking too. So definitely address to everyone. And this has closed caption availability on your Zoom link. I always like to start and remind everybody our CA bridge model here. And you guys know this, but just for those who are first time here or newer navigators, our bridge model is a 3-pillar approach. What we do in the emergency room is we provide low barrier treatment for opioid use disorder. Some of you guys have expanded for other substance use disorders, but originally we started with buprenorphine. So that's what your doctors are doing in the emergency room. Now, the other 2 pillars are connection to care and community and a culture of harm reduction. We know that you're actively working on these every single day. You're giving out patient referrals, you're helping them transition to treatment, and you're providing a culture of harm reduction. I know you're changing the culture, and giving out Narcan is part of harm reduction. So we congratulate you on all your hard work and living up to our CA Bridge model. We have a few announcements, beginning with, if you haven't heard, we've been promoting this far and wide. CH certification guide is back online. So if you have any questions, please type it in the chat or directly to us at mentors@cabridge.org. We are opening it to all CA Bridge collaborating hospital sites. So please sign up. It's completely free, and you do qualify if you've taken our Sun Training 101, all 10 session series. Again, if you have any questions, please email us at mentors@cabridge.org. We also offer a Navigator update. It's a 30-minute session, a time to ask questions and to learn about what's going on, what's trending. November 13th will be documentation tips. So if you are doing CHW billing, guess what? We're going to be here to help. And then our next Navigator Focus series, we're always looking ahead, you guys, for you. Our next Navigator Focus training will be motivational interviewing and stages of change. And you're going to like this one, because we always get people, we want to see what motivational interviewing looks like. We want role playing. So we're going to have some mentors role playing next month. So that's always fun, you guys. You guys love that. So we always read your evals. So that's always a one topic that always comes up. And then in December, nurturing your whole self and more. So lots of different things going on. For September, our Navigator Spotlight, we're very happy to announce our 3 celebrants. And hold on, screen's doing funky things. We have Roger McGilvery, Lawrence Godinez, and Karen Madeira. So congratulations on your achievement and being spotlighted this month. If you have not been spotlighted, doesn't mean you're not going to be. We know a lot of you are doing hard work, but there's over 270 navigators. So you know what? Stick around, you guys. You got to stay tuned. It might be you next. So these are our objectives today for those who are for those who do need CEUs, we're going to increase awareness of co-occurring disorders among youth and identify key characteristics as assessment referral and recommendations for working with adolescents. And we know that this is a struggle. We know there's limited resources. So we're just hoping to widen our horizons and get more information. Before we get started, I did want to give you some interesting statistics and facts. At least 1 in 8 teenagers misused an illicit substance in the last year. And the most common used substances by youth are alcohol and cannabis. So that's just going into our training today. And some key findings of a recent survey, 61% how much drug use went up among 8th graders, you guys. This is getting younger, it just seems to me, or maybe I'm getting older. So 8th graders between 2016 and 2020. So, substance use with our adolescents is rising. 62% of teenagers in 12th grade have abused alcohol, and 50% of teenagers have misused a drug at least once. That's that. Definitely kids experimenting. So always keep that in mind and get any opportunity to bring out prevention and awareness. With that, I am so excited to introduce Nernifa. Now I'm not going to say it. She told me it, and now Nernifa Nettie Barnaby. She's our substance use navigator at Children's Hospital LA. She has done some fantastic things at Children's Hospital. Youth is her experience, and so I thought it would be wonderful to invite her because she's doing this every day in person. And I know some hospitals we might not get that much opportunity, but she sees definitely a lot more. And with that, I am going to leave it to Nettie. Thank you so much for coming.
Hi, thanks, Sherry. Okay, so let me share my screen. And I'm hoping we can all see this. Okay. You can see my screen, right? Okay. So hi everybody. My name is I go by Nettie. It's easier for a lot of folks. I know Sherry was she wanted to try and say my full name, but it's okay. I'm going to just be talking about the Navigator, our MAP program that we established in our ED over the last, I think now is going to be, I think our second year. I think we've been a year now that we've been doing this. And so just a little bit about, let me see. Just want to acknowledge really quick our team, the California Bridge program, because without the grant, we were unable to do a lot of the work that we've been doing in our emergency department at Children's Hospital Los Angeles, and really kind of giving us that push to start our own MAT clinic within our substance use program. And we're hoping that if everything goes well, we'll be rolling this out towards the end of this month, sometime next month. And basically what that means for us is that now for all of our youth that are enrolled and receiving substance use services within our program, and they are in need of medication assisted treatment, we would be able to do that here within our program instead of being able to refer out. So I really did work with a really great team, our clinical champions in the ED and some of the fellows, and we did a lot of hand-in-hand work with the social work team specifically also in the emergency department, and then my own team here, our prevention team and our substance use team. We all had a hand in really creating and making this successful, like I said, not only in the hospital, but within, in our community and within our program as well. Just a little quick bio about me. I've been in the substance use field for about 6 years now. I'm a certified addictions treatment counselor. So not only am I doing the navigator role in the emergency department, but then I also still do the ongoing counseling services within our program. So our program is called the Substance Use Prevention and Treatment Program here at Children's Hospital Los Angeles. Um, we are funded by different grants. One of our main funders is the Department of Public Health and Substance Abuse Prevention and Control. And the youth that we see for our actual ongoing services is through Drug Medi-Cal. And we also have another grant that's through SAMHSA, and that's allowed us to be able to see youth who either don't have medical insurance or have private insurance and are unable to access substance use care either because of they don't want parent involvement, they don't want parents to know. So that's been an also a really great thing of being able to do that. And that other grant that we have is geared more towards our indigenous population, specifically addressing the opioid substance use disorders. So I did want to talk a little bit about what it has been for us starting the navigator role in the ED and kind of how it fits with us. And so for us in the beginning, access to substance use counseling, specifically for Matt, it was very limited. Even establishing this role of the navigator, we were hitting a lot of barriers because a lot of clinics, a lot of other programs were kind of hesitant when it came to providing MAT care for youth under 18 and as young as 12. So just a little bit of like what our work looks like, specifically working only with youth between the ages of 12 and 25 is minor consent. So as some of us might know, that in order for youth to access substance use counseling services without parental consent, meaning they won't need their parents' permission, is 12. So 12 and up. So they can concern not only to substance use, but other services related to sexual and reproductive health, mental health, without parent involvement. And because we're substance use counselors, then we're kind of hold to a different title, which is called 42 CFR, which is part 2, which is a section of the Code of Federal Regulation that provides very specific privacy protections for our youth that are seeking and are actively participating in substance use treatment. So as substance use counselors, then we're kind of uphold to this extra level of protection and privacy. So meaning we literally have to obtain written consent from our patients in treatment in order to disclose anything SUD related. And this really played a crucial role when we started to do the work in our emergency department. Because as an SUD navigator and a substance use counselor, they're two very different roles, and kind of navigating that, right? Of how much can we disclose and being able to turn one hat off when we are in the ED. And this also kind of, because a lot of the physicians and a lot of our clinical doctors, they weren't aware of some of these guidelines and some of these laws. So there was definitely a lot of pushback in the beginning when we began developing the navigator role in the ED, because they quite didn't understand and how it worked. And so there was a lot of it in the beginning, the first several months when we implemented this, there was a lot of education on our end to the ED personnel on how this worked. And how to find a way around it, not only to provide the necessary treatment, but also respecting the privacy and the rights of our youth. And so then now when we talk about access to medication assisted treatment, we know that these are medications that are regulated substances, and there were age restrictions, and there still are for individuals under 18 years or younger, right? So Um, there is certain limitations. They still require parental and guardian consent. But recently, at the beginning of this year, the Senate Bill 184 was passed, and so we're still trying to kind of figuring out um, the how it really works. But one of the things what this bill means is that if a patient under the age of 18 came into our emergency department and were requesting access specifically to buprenorphine, um, we would not require parental consent to be able to provide them this medication. So prior to SB 184, if a 13-year-old would come in and was in active withdrawals and they would needed access to buprenorphine, we would definitely had to have needed a loop in from whoever the guardian was. The other thing with this new bill as well is that it establishes that any youth 16 years or older, right, specifically just for MOUD, so for access to buprenorphine, again, for opioid use, they would be able to consent on their own if they were to go for, like, let's say, to their healthcare provider that had access to it, or a clinic. So there's still certain restrictions, right? And an example that I can give is if I had a youth that I was seeing that was exactly 16 years old, right? And they were requesting to, if they wanted access to buprenorphine within our clinic, we wouldn't need to receive parental consent. Now, if my 14-year-old would ask for access to that, unfortunately, we would still need parental consent. So there's still a lot of, there's still a lot of barriers, but uh, this is another great way of being able to, like, we're beginning to kind of break down those barriers. And then also in the beginning, I know that the California required healthcare provider certification and specific waivers um, to even be prescribed the buprenorphine. And so that was another thing with our ED doctors and our personnel and in the beginning. But from my understanding, that is no longer required to obtain an X waiver, but now they're just mandated to complete 8 hours of SUD and opioid use. So we're starting to slowly kind of seeing those limitations being reduced, but still a lot of work is still needed. Um, like I mentioned, it was a barrier for us even before starting this, of finding clinics, of finding providers that were comfortable in taking in our young patients. And a lot of this had to do with the lack of research, right? There's a huge lack of research in what medication assisted treatment, the benefits or like the negative consequences, right, of being able to provide this to youth. And on our end, on the treatment side, some of the things that we were seeing was that youth, for the not all youth, but some of our youth were not that they don't trust healthcare providers, but they've had experiences with certain healthcare providers that was not the best as far as when wanting to talk about these sensitive issues regarding their substance use. They were concerned about confidentiality, whether it's like, okay, I'm going to see my pediatrician that's linked to, my parents' insurance. Are they going to have access to the notes? Are they going to be able to see what they were sharing with them? And so that was a big thing as well, as getting even our youth to kind of get a buy-in. I'm like, hey, there's this medication that can potentially be life-saving, but they were hesitant because of how much was disclosed to the parents. And then on the other side, on the clinical side, there was still stigma, right? There was still stigma even within our own emergency department, because our pharmacy. So that was the one big thing, that when we began doing this, our pharmacy had a big pushback on this, because they were like, well, who's going to implement this, who's going to have access to it. They wanted a way to track who we were giving it to, and administering. So this area really kind of had us trying to figure out a way of advocating, and really pushing. And it helped that our um, the ED director who was on board, who really pushed back and spoke the language that they spoke. And we actually also reached out to the team over at LAC USSC, since we knew that they had been doing this for a while. And we basically, what we had to do is we got their pharmacy to speak with our pharmacy and be able to kind of exchange information. And I think it wasn't until then that they were comfortable, and say, okay, let's start doing this. Um, and one of the things is that, it's it was that's kind of what held us up in the beginning, was that of the access. Um, and of course, the healthcare providers within the, and when I'm talking about this, I'm talking within our own, hospital setting, because this is what we were seeing, is that, if you did not come from the substance use world, the providers were not really trained or educated on SUD, specifically among youth. So that also opened up a door for our program to hold these trainings with them, monthly, and having these conversations. And then there was a lack of availability of, specifically adolescent programs. And so that's still something that we struggle with. And then when we think about residential programs, right, the only really residential programs that are out there for our youth is Tarzana. And Tarzana, if any of you have ever used it, it's kind of a hit and miss. And they're all the way located in the Antelope Valley area. So for those that live in the LA County area, um, you know, working out here, LA area, Koreatown, the Antelope Valley area can be about like a 2-hour drive for some. So then there were those barriers. And then within our own program, we were unable to take a lot of these youth, because then we also had a wait list. And so then we had to refer out to other substance use programs. And unfortunately, even that, what we're seeing is that most of the substance use programs, I'm starting to see a little bit of change, but a lot of their framework was more punitive. And what I mean by that was certain, SUD programs required drug testing, either on a monthly basis or a certain time frame. And it was basically like three strikes and you're out. Um, and we kind of know that doesn't, that's not helpful. That's not really addressing, the root causes of why these individuals are using, substances. And I get it. Some of these programs are, they have to do it depending on the certain individuals that they're getting in. Either they're court mandated, right, and it's required. But with our youth, that really is not, it's not helpful. So even that still right now is something that we struggle with, finding programs that are really, and not just because I work for CHLA in our substance use program, but not even as a hospital can, I can't speak for the hospital in general itself, but for our program in particular, I do have to say that we are the very few that, this is our area of expertise, adolescent medicine. We only, like, I emphasize, we only see youth between 12 and 25, and we really approach this in a harm reduction, um, framework. Um, so as most of you know that I'm already doing the Navigator program, you know that it helps create vital access points to medication for, substance use treatment. And this has been done through funding to help establish, a protocol in RED. And since we began the Navigator role in the program within our own, emergency department, we have engaged, or California Bridge has engaged 276, and out of the 331 EDs, to become the single greatest source of new MAT initiation. So I really like that, those statistics and you can find this off of the California Bridge. And so we understand that. And I really like how California Bridge frames this in their mission statements, and their things that, they understand that our hospital emergency departments have the capability to provide wide range of services to vulnerable populations with complex needs, or lack of access to specialty care. And it is a critical time in order to be able to screen, engage, and refer patients, not just for MAT and SUD services, but for other services that they need. So I really like that about the what is, what the mission under the California Bridge is as a whole. Um, so one of the benefits that we have seen within our own ED, so what we do is we do the screening, we do the brief intervention, and we do the referral to treatment. So the way that this worked is that we needed to figure out a process on how to make this successful and make sure and kind of ensure that we weren't, some of our patients were slipping through the cracks. So the way that we decided to develop this in the ED was that when I would go in, I would identify patients that were only 12 years and older. So they kind of fell within our framework of our 12 and 25 patients. And I was screening specifically for the substance use disorders, not so just opioid, but SUDs. And so we used a tool called the S2BI, which is screening to brief intervention and referral treatment. And we did this alongside with our own emergency department's distress response survey. And so the survey, and I'll show you in the next slide what it looks like. But the survey is literally of mental health questions, and it does have a question in there that asks about substance use. So we knew that just that one question, like, do you use drugs and alcohol, yes or no, wasn't going to be enough. So we embedded our own screener that we use within our own program into it. And what's really great is that before, when we used to go, we would have to bring our own paper and kind of do the screener. And then I had to go into like our own link that we did to create it, that I'm really proud to say that now it's embedded in our own, in the own medical system at the hospital. So whoever does the emergency department distress response survey, which is supposed to be done to every patient that comes into the ED, whether it's by the nurse, the attending, the resident, if they click yes to the substance use question, the S2BI automatically pops up, and then they have to go through that questionnaire. So that's another thing that we were able to kind of start closing the loops on. And since implementing this process, the number has changed. I want to say it probably increased a little bit from the time that I did this presentation, but since implementation of our Navigator role in our program in the ED, we have screened 176 youth. Now that might not seem like a lot since we've been doing this for a little bit over a year, but I do want to point out that I'm only in the emergency department 3 days out of the week for about 2 to 3 hours. And that was, so my time was very limited there in that sense. So we were able to screen 176 youth, and out of those 176, 12 tested or screened positive specifically for opioid use disorder. So I like to point out, I think if we didn't have this implemented, that's probably 12 youth that we probably would not have been able to reach and get the necessary care. And with also us having a more of a presence there, we were starting to normalize those conversations that we have with our youth about substance use, and beginning to educate them on what medication assisted treatment is. And even if it's not for the primary reason, right? So it was all 12-year-old and patients, and some of these 176 youth that were screened, some of them are probably coming in because for either like a sprained ankle or a stomach ache, nothing related to SUD. And we were getting these questions or these answers of like, oh yeah, like I happen to engage in it. So that was very meaningful in the way that we were able to raise awareness and kind of talk about this. And one thing that we say within our program is that, 5 minutes has the same impact as like maybe 20 minutes could. And so we really wanted to increase awareness and motivation for our youth to have access to these services. And again, reducing that stigma that we had among the substance that we had among our healthcare providers in regards to substance use. And so helping our doctors and our nurses be more inclusive and non-shaming language, right? Instead of saying drug user, person that suffers with substance use disorder, right? So kind of those things, and getting them comfortable with referring to us when necessary, or referring to other programs. And so that was kind of one of the things too, is that we wanted to make sure that they had a pathway, so that when it was time that I get pulled out, that this work continued, and they had a way of still being able to refer. And this is what the screeners look like. So the one to the left, which is the S2BI, this is our own screener that we use within our program, and anybody can really use this. We do trainings on this every 2 months to our fellows, our interns. We've gone out to other programs that work with youth or that work in schools, and I've had requested screeners, not screeners, I'm sorry, trainings on how to do the screening. It's very basic, and this is implemented in our medical record system. So we're able to do that on there versus the paper version. So the way that it would work is, if I would identify any youth 12 and up and this wasn't done, I would go in there and do the questions with them. If they said yes to the number one, to drink alcohol or use drugs often, then this one would populate, and then I would go through this. And what's really great, if it's you are not comfortable using screeners, it gives you an algorithm. So I like to use it. I mean, if you were to look at it and attend a training, it's very, very useful. So it asks the questions of, like, in the past year, how many times have you used these substances? I do want to point out that when it comes to number 3, the cannabis, I like to emphasize, I like to let them know whether it's edibles or through the vape. You would be surprised how many of you think that because they're vaping, it's not cannabis. And then for number 4 or number 5, I'm sorry, when we talk about prescription drugs, because it doesn't specifically say fentanyl, and that's what we've seen an increase, I make it a side note to specifically ask for that if they've experimented with fentanyl use.
Neri, I have a question right now. I know for sake of time, Neri's gonna have to wrap up soon, but a lot of you have lots of questions about this screening tool. And so I am going to ask right now on camera if Neri could come back. Nettie, could you come back and review that screening tool in another training or session? Because I know that that's going to take time, and it looks like they have a lot of questions and they'd like it in PDF format. So definitely we can have Nettie come back and share her screening tool and how she does this. So rest assured, we saw that question. The other question had more to do with mental health, and Pooja, we'd love to follow up, off camera about this patient. And one thing before that was methadone. Are you guys giving out methadone? Do you initiate methadone in your ED?
No, so we've only got approved for buprenorphine, and we hand out Narcan and fentanyl test strips. So, like I'm showing here, all of this, because we were starting to do this work, we then were able to get the hospital to go for a grant so that they'd be able to get supplied with naloxone and fentanyl test strips. So we created this baggie. So just kind of to wrap up, we created these baggies that we have in one of our stations in the emergency department, and anybody that comes in that we feel necessary, or the doctors feel necessary that could be helpful, we give them a pouch that has Narcan spray and fentanyl test strips. And like I said, this is all have been because of the work that we've been doing.
That's
Yeah.
awesome. Yeah, you can give that to anybody. Like they don't need consent. You don't ask them their age. They can have that.
Yes, they can have that. They don't, the only thing that we do just for tracking purposes on our end, we just do like who checked it out, and that's it, like, and like initials. But other than that, we don't fill out any like identifiers. But yeah, anybody can have this.
That's
Yeah.
awesome. I love that.
So yeah, so basically that's what we've been doing, and this has been in work with you know, it took a team. There's a lot more behind the scenes stuff that was going on through this. But yes, it was a collaboration between social work, um, ED personnel, and myself, and that was in case any mental health stuff came up. Social work would be helping with those resources. In the meantime, doctors are looking through the algorithm to see how much to prescribe buprenorphine, and then me on the other end figuring out what MAC clinic can take them. So it literally was a collaborative effort. Um, so yes, I think with that, I will end.
Uh, thank you, Nettie. I knew there was going to be lots of chatter in the chat. And so again, if you have questions for Nettie, pass them on and forward. Is having office hours today at 12. So perhaps we can get to your question there if we don't get it to now. I want to thank you for the great work and you're leading the way. Nettie over at Children's Hospital, and we'd love to have you back and we will get you that training about her screening tool, because I think that was really, our navigators were very interested in that, Nettie. So definitely we will arrange that. And thank you. Thank you. Excellent presentation. Next up, we have our partners here. Saluna are here today, and I'm going to introduce Amy Gillespie and Celeste Gassio, and they're going to talk about their new app, mental health app for youth. So this is a wonderful presentation. So go ahead, ladies.
Thank you, Sherry. Hi, everyone. Nice to meet you. I am Celeste Gassio. I'm going to start sharing my screen, and you all should be able to see this now, correct?
Yes, we're good.
Okay, perfect. So we're going to share a little bit more about Saluna. I actually come from special education. So I used to be a special education teacher and coordinator, and now I work for this incredible mental health company. And I'll let Amy also introduce herself.
Yeah, hi everybody. Thanks so much. I'm work at with Saluna. I'm a licensed clinical social worker and I work as a clinical lead, so directly with our supporting our direct care providers, our coaches, and our licensed clinicians as we're providing support.
Thank you. So here is just the quick agenda of what we're going to talk about, and I'll make sure to be mindful of time as well. You can feel free to share in the chat what kind of stressors your clients are facing at this moment. I know when I've been going into the school settings, there's a lot of students that are reporting an increase in stress and anxiety, but also very much an increase in their relationships. They're noticing a lot of conflicts with maybe those they're in a significant relationship with, their close friendships, and then also those that they live at home with. So if there's anything you recognize, different stressors, you can please drop them in the chat as well. Okay. This is what we're noticing across our campuses, across the districts we're supporting, across California, the different organizations and nonprofits and healthcare systems as well that we're talking to. It very much seems to be true when I'm in person talking to youth directly. People are becoming comfortable talking about mental health. About 66% have reported they're open to talking about mental health, but then it decreases to less than half are actually comfortable talking to the adults that they live with, and then it decreases even further that they're comfortable talking to their close friends about it as well. A little bit about the company behind Saluna. So our company, Kuth, has been around for over 20 years now. We have provided support for 1 million hours of support, and then also 1 million youth have been able to access our mental health and wellness resources as well. We have a wealth of resources available on the platform that we're going to get into. I personally like to share that we are a subclinical model, so really focusing on that early intervention and prevention piece. So wanting to empower and equip our youth and young adults to access their mental health and wellness resources that are available for them, prioritize their overall well-being, and then really understand the different tools that they can add to their toolkit to navigate the challenges that they're going to be facing throughout their lives, and wanting to help them understand how to regulate their emotions as well. This is just some quick feedback that we're receiving on our platform. So we do have a community forum where youth and young adults can post. And so these are some of the comments that they've left. Our app is actually integrated with the youth and young adults voice. So when we did our soft launch back last fall, we had 13 to 25-year-olds in California help create the app. They came up with the name Saluna. They came up with the colors purple and yellow. They found it very calming. And they also came up with the constellation theme as well. We're going to go and dive deeper into what the platform has to offer, but I'm going to let Amy speak on our safety procedures that we have in place.
Yeah, so I think safety is a very important part of this, and something that we take really seriously, and something that is really thought about in so many different aspects, kind of a thread throughout so many different aspects of it. And so one thing is that, this is a space where youth can post and share information, but it's not like social media where it's, just people can post whatever and they have access to whatever. So there's a lot of content moderation that takes place that our coaches do, and also our licensed clinicians oversee. So before anything is ever posted publicly, there's content moderation to make sure that it stays first within our community guidelines. It doesn't share information. It keeps things anonymous so that people aren't sharing their name or email address or ways to get in touch with them, because everything is meant to be anonymous. But it also really helps us screen for any safety issues that come up and really identify risk. So if there is a youth that is maybe sharing something that is concerning or talking about more additional needs, our coaches and our clinicians, if needed, are going to really get in touch with that youth and provide them with other resources, and let them know, we're not able to post this because of this, but we'd really like to help you get support and really help to provide those resources to make sure that they're getting the care and support that they need. And then, when we do come across risk, we really take that very seriously and escalate that. We adhere to federal and state reporting guidelines, and then also really encourage not just sending resources, but we really encourage them to connect so that we can create more of a safety plan with them if that's appropriate, and also provide crisis resources. And just to talk a little bit more about the way that risk is identified and escalated. So with all of our services where we're interacting with youth, there is ways that we identify risk as below threshold, above threshold, or imminent. So below may be that there's something. All of these would consult with one of our licensed clinicians to provide some oversight to it. Below threshold is for something that might not be a severe issue, but something that we see that they might need some additional support. So we always follow up and provide crisis resources. We direct them to other resources within the app, and then also provide external resources. We have care navigation that can help with connecting to a number of different resources. Above threshold, so that might be where we're a little bit more concerned, but it's not something that's immediate. And then, in the same way, we'll respond to that. We'll have our coach and the licensed clinician really collaborate on creating a safety plan, ensuring that crisis resources are sent, and sharing those external resources. And then if a report is needed, that is always done. And then if an imminent risk is present, this is where we contact emergency services and ensure that they get the immediate support that's needed.
Thank you. So we're actually going to get to explore that together. I'm going to give you about a minute or two. Right now it's available on Android and iPhone. So really quickly, if you do have an iPhone, when you are downloading TestFlight on your app, you have to make sure you close it after you download, and then you can scan this QR code. So it's very important that iPhones, first you download TestFlight, close it, then scan this QR code that's linked on the screen. The one that you're sending right now in the chat, though, that's for the youth and young adults that are 13 to 25. The one here on the screen is for our stakeholders who help support youth and young adults. So this is the demo app. And then, yes, just again, very important, download test flight, close it, then scan this QR code as well. When you put the information in, make sure, because there's two pieces of information we ask from our youth and young adults, their birth date and their zip code. So you just want to make sure that the birth date you put in is within that 13 to 25-year-old age range. So either the birth year of 2000, 2004, whatever one might come to mind. That is what you're going to be doing there. And I'm going to give you just maybe a minute or so to scan both, and then we can move forward. And please let me know if there are any issues, because I would love for you to explore the demo app while I continue to go on with the presentation deck. And as you're doing that, I'll just share a little bit more. So we have our platform Saluna available for every 13 to 25-year-old here in California, because we're being funded through the Department of Healthcare Services under the Children and Youth Behavioral Health Initiative. So that's what makes it completely free for those youth and young adults. And that's why we have it to be asking for their zip code, so we know they live in California, and then their birth date, so we know they fall within that age range. Again, also our platform is anonymous, and that's one of the pieces that our service users really love, and they continue to share either in our feedback form or they tell us in person at events. The anonymity is huge for them because they're not comfortable just talking to those close to them just yet about their mental health and wellness, but they're more into exploring and taking part in their mental health journey and utilizing the tools and support that are available on our platform. And as Amy mentioned with the community forum, what I really appreciate is that the 13 and 25-year-old, they don't have access to one-on-one conversations amongst each other. They can only have one-on-one conversations with our coaches. But in the community forum, they can comment and like and have engagement in that way, because we do recognize that not everyone has a close circle of friends or people that they can talk to about their mental health. So having this anonymous, safe, and confidential space to do so allows them to build connections with others, get support, get advice, and encourage one another in this safe online space. Is there anyone that needs me to continue to stay on the screen? Or for those who have an iPhone, have you been able to close test flight and then scan this QR code so I can move forward? I'll just wait maybe 10 more seconds just in case. And remember, your birth year needs to fall within that 13 to 25-year age range. And this is the demo app for you all to explore. All right, I'm going to go on. So this is what, yes, so if it's asking for the redeem code, that means you need to close the test flight and then you download or you scan this QR code. So there's no code to put, you just have to close test flight. And then after you close test flight, you scan this QR code on the screen. Did that work for you? Perfect. Thank you so much for responding. Okay, so this is what it looks like. They have an opportunity to explore self-guided tools, community coaching, and as Amy mentioned, our care navigation. I am going to go on and show you a little bit more about what each has to offer. So in the self-guided tools, this is where we're really wanting to empower them to utilize healthy coping mechanisms and tools to support their overall mental health, and then how to regulate their emotions and incorporate these habits on a daily basis. They can log their mood for 30 days and they can contribute it to factors that are going on in their life. The star board is highly popular. It's a grid of stars. They can change the colors and it's like a fidget tool. So a lot of students like to use this when they're walking to their next class or when they're studying and they want to take a break. The let it out feature is this bubble. So you push your finger on the screen and it's a way for those who maybe have intrusive thoughts or racing thoughts. Maybe they struggle with talking to people about what they're going through. They can put their finger on the screen, and as they're releasing that thought or feeling, whether it's out loud or in their heads, a bubble starts to grow, and then they can let go of their finger and the bubble will float away. The Thought Shaker is one of our top 3. This is like a crystal ball. You shake your phone and then these positive affirmations pop up. It's been one of our top 3 tools. I think it's because with social media nowadays, a lot of youth and young adults struggle with self-comparison. They struggle with self-esteem and confidence. And so the thought shaker is a great way to shift their mindset and talk to themselves more kindly and decrease that negative self-talk. They can utilize the breathe work, the noise cleanse. They can pick different sounds. It's a great way for, I like to tell students if they're constantly doom scrolling, or youth and young adults, if they're constantly doom scrolling at night or having trouble sleeping, they can play those sounds and help relax them. We do have the free write journal as well. So this is something they can start chatting away and typing whatever they're going through, or there's prompts to help them get their thoughts out as well. They do have that safety check like you saw on our other slide. So they are aware that our team does monitor. Reason being because we've had youth and young adults express that they're either engaging in self-injurious behaviors or they have thoughts of it or thoughts of suicide. And so we are alerted in those cases. And then like how Amy talked about, we do have safety measures in place to address those situations and help support. You'll also notice the community section. So this is where they can engage in polls and reflections. We also have YouTube live events where they can add to their calendar, and then those discussion forums where they can talk to each other amongst those peers across California. And again, no one-on-one conversation for safety reasons, but just a way to build relationships with peers that might be going through the same things they are. Oh, yeah, Sherry loves the thought shaker. And then there's a lot of different content they can explore in our library. Because I come from that special educational background, I love the multisensory approach to it. They can listen to audio, watch videos, read stories. They can go into the library on the STAR homepage and search. You can put conflict and you can find different content. It's definitely geared towards the Gen Z audience. And so you'll notice some of the language here. One of the videos I personally love in the Finding Calm constellation, if you search waves, it's a video of the beach, and you can hear and look at the beach, the waves crashing against the sand, and hear just the ocean in the background. I find it very calming. So we have a bunch of different constellations to explore. And once you pick a constellation, the constellation changes, as well as the tools and resources that match it. Our coaches, we have mental health coaches available every single day, including holidays, from 10 a.m. to 10 p.m. What I really love is that they can either book a chat, so they can go in and explore the different coaches. It gives them that autonomy to choose the people they want to have these conversations with. They get to understand their specialties, their hobbies, their interests, their backgrounds, and they can go into their calendars and click a day or time that works best for them. They can keep talking to the same coach, or they can do the random drop-in, so it's whatever coach is available. And then the coaching sessions are about 5 minutes to 45 minutes. It's really dependent on the service user. Oops. And we also have available telecoaching. So all 19 languages that are covered under Medi-Cal, they can support via telecoaching as well. What we just added is that service users have the opportunity to do chat-based conversation, or they can engage in video chat, because that was something our youth and young adults requested, because they didn't know if they were talking to AI. They wanted to maybe see the person behind the screen that they were talking to. These are some conversation starters to possibly utilize when you're having conversation with those 13 to 25-year-olds that you might be supporting. One thing I loved learning with Sherry at another event was that, mental health disorders and substance use disorders do coexist together. And so this could be a great tool for them to use when they're not with you, when they're either at home or on the weekends, just to fill in any gaps of care and that extra layer of support for them. Just curious, what do you wish, as you're looking and exploring through Soluna, what features do you wish you would have had when you were a teenager? And you can share in the chat if you would like. Me personally, I think I agree with Sherry. The thought shaker would have been really great, especially because at that time, social media was up and coming and definitely affected my self-confidence and self-esteem. And I would have appreciated the opportunity to talk to mental health coaches whenever I would like to, since I didn't have that type of communication dynamic at home in my household. So it would have been nice to have an anonymous space to engage with coaches and get some support. The thought shaker, Diane, thank you. Yes, that's definitely a favorite. But we're just really hoping to be integrated as an extra layer of support. We're not looking to replace anyone. We definitely can't do the things that you do. We are subclinical. We're just really wanting to help support as another resource for youth and young adults to utilize and have at their fingertips. Iman, the forum post to connect with other youth going through similar stuff. Yeah, when I presented at a high school, there was a female student who read a certain post and said, you know, I actually just went through something similar. I'm actually going to respond to this person and kind of share what helped me in that time. So it's really great that they like to support one another and be an encourager and offer advice as well. Yeah, knowing you're not alone would have been great, and knowing that others also are struggling and have similar experiences as you. The let it out, yes. Expressing some things that you're bottling up and that you need to release and not hold on to. We do have another partner program, Bright Life Kids. So California is funding both. Bright Life Kids is a parent-focused app for 0 to 12-year-olds and supporting parents around social emotional development, milestones, behavioral management, and then Soluna is independent platform for anyone who's 13 to 25 in California. So if you want any more information, we do digital toolkits for free, printed materials in English and Spanish for free. There's different partnerships that we have to offer as well. You can just scan this QR code and here's our information. But I know that Sherry is going to be sharing this PDF as well with you all in the email follow-up. Oh, I'll just keep that for one more second if anyone was trying to skip. But thank you so much. If there's any questions that Amy or myself can answer really quickly for you all, we'll be happy to do that if you have any remaining questions.
Well, I thank you, Amy and Celeste. I just think this is such a great tool, you guys, and I invited them because it just is so easy. The app is easy. I love the way it looks. It just made sense. And I really appreciate our speakers today. If you don't have any questions, that's quite all right. We can get questions to them. I do hope you use this. I just know recently in my community, there were 2 teenagers in 2 weeks who unfortunately jumped off a freeway. One was related, and I'm sure you're in my area, right, Celeste? So you've heard this. So if, you know, it's always a good tool to have, especially sometimes parents don't want to talk to us and maybe the child does need help. And this is just a really simple way to offer. I love the printed materials they're offering for free. So again, thank you for your time and another resource to put in your toolkit, you guys. You're always wanting these. And this is something that no matter where, if you live rural, you know, anybody can use it. So I'm really excited that you're here and that you presented. I don't see any other questions. I think they're all playing with your app, right? I think that was the
I
distraction.
hope so. Yes, please have fun exploring it. It'll definitely give you an idea of the service user experience.
Right. And speaking of mental health, we still are offering mental health first aid for free. It's a 3-year certification. So if you are still interested, they did open up a second class. So please, sign up. You can still sign up. It's not too late. And they will offer that second class. And again, we're just always trying to find some resources for you. I'm going to put the QR code on. Hold on just a second. I'm trying to get the QR code if you are still interested in the mental health first aid. We know that so many have co-occurring conditions. So again, we just want to give you the best tools so you can have resources and, you know, not work so hard, right? Thank you for joining us. And if you have any questions, always let us know at mentors@cabridge.org. You can always ask us questions. And again, thanks to our presenters today. We really appreciate your time. It's 12 o'clock and thank you very much. Bye-bye.